Hello, and thank you for tuning in to watch this short module on the COVID-19 pandemic and public charge. My name is Sarah Lacani, and I'm an attorney with the Immigrant Legal Resource Center in San Francisco. I hope that when you have time, you'll also watch the other modules associated with this presentation to learn more about public charge. Module 1 covers what public charge is and who it applies to. And Module 2 discusses how the public charge test works. One note regarding these modules is that they were created specifically for the immigrant community in California. Some information may be applicable to immigrants who reside elsewhere in the U.S., but keep in mind that I will refer to public benefits programs and relief funds in California. Let's talk about the COVID-19 pandemic and its connection to immigrants and public charge. As you know, we're in the middle of a worldwide public health crisis as the deadly coronavirus continues to wreak havoc. The virus hit the United States in January of this year, just a month before the Trump administration's new public charge policies went into effect. The president declared a national emergency on March 13th, and states and counties across the country began implementing shelter-in-place policies to limit the spread of the virus. There have been significant economic consequences stemming from the virus, including massive job loss. As difficult as the pandemic and economic crisis has been for many in the United States, low-income immigrants are being disproportionately impacted by COVID-19. For instance, immigrants are playing critical roles in the pandemic response as essential workers, as farm workers and medical professionals, for example. But so far, immigrants have been mostly excluded from the federal relief packages passed by Congress. At the same time, the new public charge policies, which are punitive and confusing, have deterred many immigrants and their family members from accessing medical care, health coverage, nutrition assistance, and other aid. We want to urge community members to access the care and services they need during this trying time. USCIS has announced that testing, treatment, and preventative care for COVID-19 will not be considered as part of the public charge evaluation. These services will have no negative impact, even if provided or paid for by one or more public benefits included in the rule, like regular full-scope Medi-Cal. USCIS has also said that people who use public benefits because of COVID-19 related factors like quarantine or employer shutdown may submit a letter of explanation to USCIS, and officers will take that into consideration in their public charge assessments. We aren't sure exactly what it means that USCIS will take into consideration that someone used public benefits like food stamps due to COVID-19, but we hope it means that USCIS will not look unfavorably upon it, even though such benefit use will be evaluated. It's important to remember, too, that emergency Medi-Cal is exempt from public charge, meaning that if you lack health insurance and seek out COVID-19 care in an emergency room, for example, that won't count towards public charge. Separate from U.S. immigration agencies' announcements around COVID-19, over the past few months, we've seen Congress take some important steps to help people who are struggling economically as a result of job loss or other financial hardship related to the coronavirus pandemic. However, the federal COVID-19 relief packages only provide support to those with a valid Social Security number. This includes some members of the immigrant community, but not all. Some of the forms of support provided by the existing federal relief packages include financial aid to taxpayers who qualify based on their income level, as well as more robust unemployment compensation to eligible workers. Importantly, neither of these forms of assistance count for public charge purposes if the recipient will have a public charge test. This is because tax credits and unemployment aid are public benefits that are specifically excluded from the public charge test. As I just explained, unfortunately, the federal COVID-19 relief programs enacted so far exclude many immigrants from key forms of assistance, including the financial aid to taxpayers. Fortunately, we're seeing states and localities across the country stepping up to fill some of these gaps by designing their own emergency relief funds. This includes California, which is providing funds through the Disaster Relief Assistance for Immigrants project. I'll talk about the details of this program in a moment, but I'd like to first discuss public charge concerns related to accessing these local emergency relief funds, including California's program, but other programs too. We're getting questions about the public charge risks of accessing these programs. The main question is whether USCIS would consider these funds, which offer cash aid, to be cash assistance for income maintenance, which would count in a public charge test, or if USCIS would consider these emergency funds to be disaster relief, which would not count in a public charge test. Unfortunately, USCIS hasn't provided any guidance during COVID-19 on this issue specifically, but we have strong arguments that these emergency funds are disaster relief, which wouldn't count against someone for public charge purposes. For example, there is reassuring language in the new DHS public charge rule that we can rely on, stating that the agency will not consider all forms of cash aid as cash assistance for income maintenance, including federal, state, and local disaster relief. Remember here too, that unless a person is actively applying for a green card through a family member or for permission to enter the country, they will not even face a public charge evaluation. So their focus right now should be on taking care of themselves and their families during this extremely difficult time. They should access the assistance available to them if they need it. One of the great local emergency relief funds that has been created during COVID-19 is the Disaster Relief Assistance for Immigrants project in California. Through this program, the state of California is providing one-time cash assistance directly to undocumented Californians who are affected by the COVID-19 pandemic but are excluded from federal relief and ineligible for most state safety net programs. To be eligible for this disaster relief assistance, a person must be able to show that they are an undocumented adult, that they are not eligible for federal COVID-19 related assistance like the tax credits or pandemic unemployment benefits, and have experienced a hardship as a result of COVID-19. Successful applicants will receive $500 or a maximum of $1,000 per household. The disaster relief assistance is being administered and delivered through 12 nonprofit organizations located in various regions of California, and these nonprofit organizations began providing assistance to applicants on May 18, 2020. People are only allowed to receive the funding assistance from nonprofit organizations assigned to their county or region. Assistance is being provided on a first-come, first-served basis, and the state anticipates that the funding will run out before the program ends on June 30th, 2020. We encourage you to learn more about this program if you think you might qualify, and to reach out to the nonprofit organization assigned to your county or region. Information can be found at the website listed on the slide. As with other state and local COVID-19 relief funds, there should not be any negative public charge implications of using these funds. Another important source of assistance for immigrant families that we want you to be aware of is Pandemic EBT. In California, families with children who are eligible for free or reduced priced meals at schools that have closed due to the coronavirus can receive a preloaded EBT card in the mail for every eligible child in an amount of the value of those school meals, depending on the time their schools will be closed, up to a maximum of $365 per child. These EBT cards can be used everywhere that CalFresh EBT cards are used to buy food. How do you access Pandemic EBT? Families with children who receive CalFresh, Medi-Cal, or foster care benefits do not need to apply and should have already received their Pandemic EBT cards in the mail. Families with children who are eligible for free or reduced price meals but who have not yet received their Pandemic EBT cards in the mail should apply online now before June 30th at the website listed on the slide. We want to assure you that use of Pandemic EBT does not count in any public charge test you might have because it is a form of disaster relief. To close, I want to leave you with a few extra resources that may be of help during this time. Separate from California's Disaster Relief Assistance for Immigrants project, there are several organizations in California that are providing cash aid to immigrant communities facing financial hardship right now. You can find out more information about these organizations and how to apply for aid at the website listed at the top of the slide. Next, if you are struggling to feed yourself or your family, remember that there may be a food bank near you where you can obtain food for free. If you visit the website on the slide, you can enter your zip code and see if there is a food bank nearby. Also, there are no public charge issues associated with getting food from a food bank. Lastly, if you need to get tested or treated for coronavirus or any other ailment, know that you can always seek care at a community health center near you. If you go to the website on the slide, you can find the nearest community health centers to you by entering your address or zip code.